EMDR is not hypnotism. And I think in general, therapy is not about me fixing my clients, giving them advice, telling them what to do. With EMDR, we are resetting a memory. So it is very hard. I call it therapy with the gas pedal because it is very intense.
Welcome to Mental Health Matters, a Cornerstone Behavioral Health podcast. I am your host, Caleb Folkerts, licensed psychotherapist and founder of Cornerstone Behavioral Health. This podcast brings you the knowledge, insight, and real human stories your providers wish you knew about mental health. In each episode, you will hear real conversations with the professionals who support mental health across the full continuum of care. Our guests include therapists, psychiatric nurse practitioners, primary care physicians, frontline clinicians, and leaders throughout the industry. Together, we explore their journeys into the field, the people they work best with, the tools and strategies they rely on, and the lessons they have learned from years sitting with clients during some of the most important moments of their lives. If you want to understand your own mental health more clearly or find the right provider for your needs, this podcast will help guide that next step. This is Mental Health Matters. Welcome to the session. Taylor, welcome to the show.
Thank you.
I know that I've had the pleasure of knowing you for quite some time. So we've got good rapport, good connection. It's been a pleasure. I know that you originally came to us whenever you were still going through the counselor trainee journey. So it's been a pleasure to see you grow past that into fully licensed professional counselor. And I should say pursuing and having accomplished the EMDR training that you've accomplished thus far. Welcome again to the show. Essentially, general thrust is introducing you to the people. So just giving some insight into your hero's journey, like we all have one as a clinician. And so just kind of the past, present, and future of you. Just kind of diving in, before you became a therapist, who were you?
Gosh, I would say I was definitely a nerd. I loved school. I loved learning, still do. A little bit of a perfectionist that I've worked through, so I know I'm getting ahead of myself, but I love helping other people through that as well, because I know what that's like. I guess we're going way back, right? I was also a dancer. I loved ballet as a kid, growing up. Let's see, modest, I could say. I'm having trouble talking about myself. It is strange. The strange is good, right?
Yeah.
I guess that's another thing about me is, right, I am someone who likes the unusual. I don't like norms. I don't believe in following arbitrary norms.
Mm-hmm.
As a little kid, I needed to know that why.
Mm-hmm. This is essentially the shoe being on the other foot, because like normally we're dimmer switching ourselves down and we're amplifying the client. So absolutely, like what we're doing day to day, this is sort of the opposite. It's still very social, but the focus is inverted. So yeah, it makes total sense. So into ballet, into the unusual, open to the strange. What early experiences, it might be some of the things you already mentioned, what early experiences or moments shaped you more than maybe you realized at the time towards becoming a therapist ultimately?
Yeah, probably I've always been a good listener going along, right? It's weird talking about myself. So I've always been just naturally in conversations and relationships, more of the listener and someone who reflected on, other people, what was going on. Other kind of like big moments in life that led me here to counseling was, right, wanting to understand people and knowing their stories. I always loved stories, like so much so that as a little kid, I had a book of fairy tales that completely crumbled apart at the spine. I loved stories, loved, gaining other people's perspectives and understanding their lives that were different to mine, right?
Absolutely.
Knowing, right, someone could be so similar, right, in life, gone through similar things, but we're totally different people. I always liked TV. Watched, some would say maybe a little too much. And in like the summer before fifth grade, I discovered true crime documentaries. For some, I don't know why they just kept playing a lot of Charles Manson, child killers, and I was
Mhm.
like, what happens? How does, right? We all come out basically the same, right? I would assume blank babies. How does someone go from, right, that sweet, innocent little baby to a leader of a death cult?
Mhm. Yeah.
And yeah, I was like, I'm trying to learn human nature, right? I guess eventually turned into, right, how do we stop it? How do we,
Mm.
right, redirect back to, right, turning someone into a regular, functional member of society, right, than a hurtful one.
Sure. Absolutely. Yeah, I think for a lot of us, it's sort of the extremes of abnormal psychology that sort of is initially intriguing, and then you go through the gauntlet of like diagnosis, assessment, and then you're working, with clients. I do know that there is. I don't want to steal the thunder, but I know that there's a specific passion, not directly related to what you're talking about, but sort of adjacent. So we can definitely highlight that perhaps later on. But I know that whenever we get into the good work, we sort of arrive at that like spectrum. Sort of normal being a relative term, but between the sort of innocent babe, the Charles Manson, there's a whole bell-shaped curve of humanity that we interact with. So that sort of intrigued you. What sustained you in the field as you're going through that trainee experience, accumulating your own caseload as a licensed clinician now. What have you found on the other side of that?
Yeah, I think I definitely went through a shift of, right, like I said, going to the big extremes, the big headlines,
Mhm.
to, right, the ordinary everyday, right, the usual people, right? No one likes to be called like, oh, usual, but right, honestly, that's where we are. And
Mhm.
with my other love of history, it's a strong parallel there of, right, going from big important people, royalty, and all that to, what were regular people, right? What were the peasants doing at this time? What were their lives like? What were they wearing? What were they eating?
Mhm.
That's kind of contributed to, right, where I am now. I want to be there with people and talk them through their everyday lives, the stressors, the hassles, and the joys. And
Yeah.
that's what really sustains me is, right, seeing that full life and helping people see all these different aspects of life and getting it into balance.
Yeah, absolutely. So not all that glitters is gold, but yeah, still valuable. What is the story behind how you became a therapist? So, we're kind of went through some origin stories piece. We went through some of what pulled you towards that as like an academic focus. But I guess, what's maybe that superhero origin story of like this was sort of the catalyst and this carried me through.
Mm-hmm. Yeah, so learned about forensic psychology, got me into psychology, which was my undergraduate degree. I then, funny enough, another TV documentary, but this time about the people who survived cults. And went through
Mhm.
it and learned that exit therapy was a thing. I was like, oh, that sounds interesting. Let me look more into it. And I went to a whole rabbit hole of learning about trauma counseling. I said,
Mhm.
oh, I can definitely see how what I know in psychology, right, human development, human behavior, right, and go this different route than research, which is where I intentionally thought about going into.
And that thus the sort of EMDR tag that I was plugging earlier. So yeah, so Charles Manson, to those that have survived cults, extremely negative religious experiences, and then that sort of tethered to a more ubiquitous, more common thread, throughout the bell-shaped curve of trauma. I know that that's something that we both share. Um, and again, not here to steal thunder, so I'll maybe just prime it with a question: is like, what was it about trauma? Um, what was it about that pulled you? Like, why that diagnosis?
It was really interesting to me that big T traumas, right?
Mm.
The big labels for what we give PTSD to, is very similar to what they call little t traumas, things that build up that all go all throughout our life, and learning about toxic stress and how that all comes together. I feel like in society it gets minimized, right? Like to get the PTSD diagnosis, you have to have one of those big T traumas, a big event. But when there's more research coming on, right? I won't be judgmental, right? And learning more from people like Bessel van der Kolk and his work, The Body Keeps the Score, and learning that body-mind connection, so fascinating to me, and really is where I want to be, and helping other people learn about it too through like psychoeducation in the work that we do.
Yeah. Big fan of Bessel. Can't be not a fan of Bessel and be into the trauma work that we're both passionate about. So love the little t, big T distinction, and shining a light on maybe what has less notice, but is of equal importance. Yeah, absolutely love the advocacy in that answer. What experiences, either personal or professional, fundamentally changed the way that you practice?
I would say my counselor education, my master's, changed a lot because it was so different from coming from a clinical psychology standpoint. And right, the little tidbits that I've learned about counseling and therapy through there, right? I thought uh, getting wordy, but Rogerian, the person centered, right? Talk it through, be very empathetic and validating, was complete opposite of Gestalt, which is basically the most advanced tough love a therapist could get. It's like, no, the two can mix. They can mix really well. And I do that. And I enjoy doing that.
Yeah, for those that might not be in the know in the field, there's a term that gets used a lot in counseling called the eclectic modality, which is figuring out how to tether, these different therapy styles, and it does take a creative mind. It takes an awareness of like what's distinct and what's important about two seemingly different modalities, and that's sort of where like the art and the science merge. So yeah, pairing seeming opposites. Yeah, definitely a creative endeavor. I know that the EMDR piece is certainly a big tool in your tool belt. Is that how you would describe, apart from EMDR, your style? It's like sort of Rogerian and Gestalt, or don't let me put words in your mouth. If you want to reconfigure it for sure.
Right? Yeah, for one, I would say like, regular talk therapy, apart from EMDR, I'd say it's definitely heavily Rogerian, person centered, lots of validation, listening, reflecting, right? I really enjoy those types of sessions where I can be the mirror to
Mhm.
someone and we do equal amounts of work. I'm not on the white tower of
Yeah.
academia saying like I am the expert, you do what I say. Like
Mhm.
no, you are the best expert in you. We work together for therapy to work. You have to put in the work in. So to help me help you to best put in that work. How are you going to do it?
Absolutely. So there's an egalitarianism to what's going on. Yeah, there's a power distribution, and trying to keep that even as far as input and output. Yeah, absolutely. Um, if you were going to maybe break down what you were leading in with, you did already a bit, but that person centered, Rogerian, and then like Gestalt, how would you maybe break that down, explaining it as if I were a client?
Okay. So yeah, it would be right clients. They tell me what's going on currently or in the past. I reflect back. So it's not exactly parroting. Sometimes it can feel that way, but it's really when we talk, it sounds so much different to ourselves when we hear it back, even in a slight way. And I can use my background to nudge a little bit, but
Mm,
not prime you and like manipulate you in any way with that, so that the conversation keeps going and it moves deeper, it moves away from just surface level things, and we can get down to the meaning of it, right, the patterns in life, and help you make those connections, right? I
mhm.
can make connections, but it's so much better when the clients do. It's so much more meaningful. And
Yes.
sometimes, right, Gestalt helps with that. It's kind of like I call it professional sass or professional reading. Um, that, right, is needed to kind of hear things, like I said, in that tough love way of like, I am supporting and validating you, but in a way that you need to hear, maybe not always want to hear.
Sure. Yeah, and that's an important blend, absolutely, because yeah, there is certainly a point where like the benefit of therapy is having someone who's certainly not here to dictate what you're going to do as a client. You know, we're never here for that. But if we were just sort of complicit to whatever end, we might, sort of follow the client to a negative end if we didn't, maybe put forward an alternative way of thinking or an alternative way of doing. Love that. How would you describe what you want clients to feel in their first session with you?
Let's see. First, treatment session or in that initial comprehensive assessment?
I would say first point of contact. So yeah, comprehensive assessment. For those that aren't in the know, assessment leads to treatment planning, leads to the good work that we all want to jump into, which is talking with each other and actually getting down to the nitty gritty. So yeah, first point of contact, that assessment piece.
Yeah, so first impression, I definitely want them to know or get the impression that I am warm and kind. I've heard that I am. I'd like to believe so. That I'm here for business to help them, but we can also have fun sometimes, right? Some levity, some even whimsy at times when appropriate, right?
Mhm.
Therapy is hard, but it can be fun sometimes.
Yeah, I think the fun part is that you're not doing it alone. So there's someone to well, sometimes you laugh and sometimes you cry, and sometimes either or both is appropriate and therapeutic. But yeah, having someone else to share that with, yeah,
Right? Like to get back to the hero's journey, like I am the Gandalf in their journey.
love it. My inner nerd, which I also share, is is absolutely thrilled at the connection. Also, perhaps a Halloween costume for next year. That is up to you. That's certainly up for you. But yeah, that's the archetype, though, right? Like, you know, bring it back to center with like Carl Jung, right? Big psychoanalyst.
Yes.
And really broke down that we think in archetypes, right? To go back to your story mentality, is that's how we understand life, right? If you tell something as a story, the memorableness of that versus just giving people disconnected facts and hoping that they can make a constellation, like that's just how our brains work, is in narrative. Um,
Absolutely.
those archetypes, like those types, like the wise individual that sort of comes alongside you in the journey, in their hero's journey. Yeah, yeah, you take that role. I love that. Yeah. So there can be fun. It's not just sweating and just white knuckling through it and crying. But there are points of levity. There are points of whimsy. Great word, by the way. Big fan of the word whimsy.
Thank you.
So you've kind of shared a bit about who you are. What, in your opinion, constitutes a good fit client for you? So obviously, here for any and all combinations of human, but as far as like characteristics, right, there are certain things, there is a chemistry to what we do. One person, one therapist is not a one size fits all necessarily. um, and so, I guess, what characteristics do you think constitute a good fit, the best fit, in your experience with client work?
I think with the modalities that I work with, they're best suited for people who are insightful and reflective, um, who understand that, right, people are inherently adaptive. We do what's best for us. So when there's work to be done, right, they put in that work, right? It can be scary, it can be hard, but we're
Sure.
doing it together.
Yeah, the adaptive piece. That's a great word. And the insight piece always goes a long way. I know um, sometimes clients might come through and they might feel like there's just just a big ball of I don't know, and that's usually where those that are engaging in treatment start. But even if you feel that way, that doesn't mean you don't have insight.
Mhm.
It's sometimes someone asking questions that your mind has never thought to ask itself. That's sort of where our sweet spot is for bringing value. So yeah, you might find that you're more insightful than you give yourself credit for, and once you engage in treatment and have that other person to kind of poke and prod in a friendly way.
Mhm.
So as far as, I guess, tools or frameworks or techniques, how do you adapt tools? I kind of going along with that word adaptive.
Mm.
So on your part, how do you adapt tools and methods in real time? So kind of still going back to that thread of eclectic, of kind of marrying these seemingly disparate things. How do you flex for the client in real time?
I listen to the client, right? Like I want them to listen to me when I'm like, hey, we're gonna practice the skill or something of that nature, right? I listen to them. Be like, okay, are we someone who is more of a thinker?
Mhm.
And right, we can change our thoughts, we can change how we're doing, right? We can do certain techniques. Other people, they're more feelers,
Mhm.
right? They can not even have the thoughts. It's all about emotions and body sensations. And so we'll work more with that. So it's going for your strengths. I'm listening for those strengths that I can run with and we can run with.
So I know we've talked about the heavy elements, trauma. I know that you also pair very well with anxiety, with depression, with those life transition elements. But from whatever passion point you have, what would be one concept that you wish more people could know, would know?
Hmm. EMDR is not hypnotism. And I think in general, therapy is not about me fixing my clients, giving them advice, telling them what to do.
Mm.
With EMDR, we are resetting a memory. So it
Mhm.
is very hard. I call it therapy with the gas pedal because it is very intense. So if life is very stressful right now, right,
Mhm.
we can still work things through, but it's going to be the more traditional way.
Mhm.
EMDR is definitely when, okay, things are steady. I'm ready to charge through the tunnel, right?
Sure.
Full gas. I can run through and re experience those traumas again. I have the supports, I have my window of tolerance, that emotional regulation,
Mhm.
right? If we're not ready for it, we're going to work on. EMDR is very structured, but there is some flexibility within it.
Yeah, absolutely. What tends to surprise clients about working with you? You think there's anything that maybe they didn't assume on the front end that they might be pleasantly surprised by on the back end?
Yeah. The biggest one is a humorous one. People always think I'm younger than I actually am. I'm about to be 31, and that throws clients a lot sometimes. So they're like, wow, you are so wise and so smart for your age. How do you know? Because I like to throw in some science facts if like I see that it'll land well. They're like, oh, how do you know so much? I'm like, yeah, I'm up there a little bit.
I know that I fell into this as well. I think that you started mentioning like movies that are from my generation, and yeah, I sort of double took. I was just thinking, is this just sort of coming back into full swing? I know that we were connecting on the original Beetlejuice. And
Mm-hmm.
so I fell into that as well, admittedly. But yes, definitely wise. Definitely got wisdom in there. And always nice to have similar overlap of like pop culture reference. That always helps. You don't have to have that, but it's nice. Um, so, without identifying details, of course, what's a client theme or a story? Maybe from EMDR if you're comfortable with that, or wherever you want to take that. But what's a client theme or a client story that stayed with you?
It is those moments of insight. such as in the EMDR, right? Like I said, it's structured. We have phase 7 where we're reflecting and we're kind of calibrating back to the day and seeing those insights that people make. That's what really stands out. And right, what like we talked about earlier, what keeps me going in counseling is seeing those moments of breakthroughs, the aha moments. And what's funny in a not in an actual funny way, but in a like, oh, kind of way, is usually they're so simple. They're so basic on a logical format, but feeling and knowing are very different things.
Yeah. Yeah. Thinking and knowing and understanding. Yeah. There is like, there's a difference between being able to say something on like a multiple choice test, versus knowing it in your bones. Yeah. Yeah,
Yes. Right?
absolutely.
Like with EMDR and trauma, a lot of the times it's I'm responsible or right, it was my fault. And going to,
Mhm.
oh, it wasn't my fault. I would not blame, a 3-year-old girl for this. Why was I doing that for myself?
Yeah, absolutely. And that, I think that's a piece with trauma work that resonates so much is, I'm a fanboy for few, but Eric Gentry, Dr. Eric Gentry, shout out. One of the first sort of epiphany moments in being trained way back in trauma work for me was the understanding that, like, sort of the litmus test of if someone has really overcome the trauma, right? Not that it doesn't have any residual effect whatsoever, but that it doesn't have that active frequency, is that they're no longer trapped in the first person narrative, but there is this
Mm-hmm.
third person. They're able to look at themselves in the situation and, detach in a good way. And it's again ironic, that in detaching, you reintegrate, the mind and the body. So it's that old adage that whenever you look at things differently, the things that you're looking at change, right? Whenever you think about things differently, the things that
Mm-hmm.
you're looking at, begin to alter. And that's like fundamentally, right? That's the thing that we're moving towards in that work. So yeah, great answer. I know that we're butting up on time. I did want to ask, just on the human side, what are some strengths, quirks, habits? What's a if I were interviewing, 10 or 20 of the clients that have worked with you, what would they, if they could group up, like what's a Taylorism? What's strength, quirk, habit, anything?
Let's see. Strengths would probably be making connections that they
Mm,
didn't see,
yeah.
seeing meanings
Mm,
in things. Quirks, some self deprecation, right? I bring myself a little bit as a human, right? I will forget words and it takes me a second to remember. And that's okay, right? I tell my
sure.
clients they're not allowed, right? It's hurtful to judge ourselves. And so
Mhm,
I laugh at myself.
mhm.
I think that comes across.
Yeah, human just like the rest of us. Yeah, no perfection required,
Mm-hmm.
to be good at what you do, which you are. Well, Taylor, I really appreciate your time. I know this is not, the last time, first of hopefully many, times on the podcast. For those that are interested in learning more about you, or perhaps, moving to work with you, where can people find out more about you?
Probably at the Cornerstone Behavioral Health website, cornerstonebehavioralhealth.org/new clients.
And then, if they do want to look, we have a team section that's sort of in the top end of the website if you want to, deep dive a bit more into Taylor. But yeah, sure that they've gotten a good, good introduction to you from this. And again, looking forward to future connection. Thanks again, Taylor.
Thank you.
Thank you for listening to Mental Health Matters, a Cornerstone Behavioral Health podcast. If you want to learn more about our clinicians, prescribers, or services, visit cornerstonebehavioralhealth.org. Take care, be well, and we will see you next time.